our team discussed the prevalence of anxiety in adolescents and its effective treatments. According to the National Library of Medicine, 1 in 8 children worldwide suffer from anxiety, which is almost 250 million children.
So how does anxiety affect these children? Well, the part of the brain that anxiety primarily affects is the frontal cortex, which is involved with motor tasks, judgment, abstract thinking, and maintaining social situations. Anxiety affects the frontal cortex by making it sensitive to danger and then altering its perception to that danger. And this can be seen through trouble with communication, personality changes, an increase or a decrease in self-awareness, mood swings, and depression. The second part of the brain that anxiety mostly targets is the limbic cortex, which is in charge of behavioral regulation. When anxiety affects this, we're going to see the typical personality changes perceived in patients with anxiety, such as irritability, fatigue, irrational fears, increase in worry, and similar symptoms. And then physically, anxiety affects the autonomic nervous system, which supplies nerve endings all over the body, but most importantly to the heart, lungs, and smooth muscles. And then it also controls their involuntary functioning. When anxiety affects the autonomic nervous system, we're going to see the typical physical symptoms of anxiety, such as nausea, headaches, trembling, and then the sick feeling that anxious patients normally have. So what relationships cause this anxiety? Well, the most important relationship in every child's life is going to be their relationship with their parent. And in a study by Kim Kalu, she found that parents with high levels of anxiety tend to have children with high levels of anxiety, not because of a genetic predisposition, but because through everyday situations and parenting choices that these anxious parents choose to make, they involuntarily show their children anxious patterns very early on. And as these children grow and develop, when they're confronted with situations, they tend to react with those anxious patterns because that's just what they've been grown up taught and enforced. The second most important relationship is going to be the relationship with their community, mostly with children their own age. This can be seen through social exclusion anxiety, in which a child is scared or nervous to interact with children their own age for fear of saying the wrong thing or just not fitting in. And this social exclusion anxiety is particularly difficult for children because it leads to a seclusion and children not wanting to be involved in their community, which then leads to underdevelopment of the children's ability to be social, which then just compounds the issue because as they're underdeveloped socially, they don't want to interact because they don't know how to act in those situations. Now, what measures can be taken to minimize this anxiety?
One way is with medication. In general practice, benzodiazepines are used in the management of anxiety disorders. What benzodiazepines do to reduce anxiety is enhancing the neurotransmitter GABA, which is a chemical in the brain that makes people feel calm, while another medication is selective serotonin reuptake inhibitors, also known as SSRIs. What they do to decrease anxiety is increasing serotonin in the brain. Doing this affects neural systems, which regulate mood, sleep, appetite, and digestion. The benefits of medication is as a quick way to help minimize anxiety that children might face, as long as the right medication is prescribed. Other benefits of benzodiazepines and SSRIs is that they help in the treatment of other medical diseases. There was an initial study between chronic benzodiazepines and dementia that showed in a study nationwide of 235,465 patients reported no association between subsequent dementia and benzodiazepine use. This can lead to the conclusion that benzodiazepines may have protective effects against dementia. Benzodiazepines are also used in the treatment of insomnia due to its calming effects on people, while SSRIs have been found to help the brain restructure parts of itself. This means the brain is more amiable to new changes in learning. However, the limitations of medication are cost, effectiveness, and side effects. The cost of these medications can get extremely expensive since they have to be constantly taken to show treatment results. And when these get very expensive, the insurance can also as well get expensive when there is no insurance. The effectiveness of benzodiazepines is as very good at decreasing anxiety. However, it's not recommended for children or teens because it makes them more irritable rather than calm. While SSRIs have been found to increase brain's ability to restructure parts of itself, this doesn't mean that the brain is actually having a decrease in anxiety. This means the brain is more capable, that can lead to changes that lead to decreases in anxiety. However, it's up to the patient's responsibility to promote changes that can lead to their brain having decreases in anxiety, such as learning ways to effectively deal with anxiety situations or avoiding anxiety-provoking situations. The most serious side effects of benzodiazepines is drug tolerance, which can lead to psychological and physical dependence. This drug is also known to be highly addictive. Because of this, this drug is only recommended for acute anxiety and for a short duration of time. While the most common side effects of SSRIs are headaches, drowsiness, dizziness, and insomnia.
We found that another really good way to help reduce anxiety in children is therapy. Under this, we found two different types of treatment. The first one being individual. This is where a child will partake in therapy with a therapist by themselves. We also found that familial therapy is another really good treatment. This is where a child will partake with their parent, guardian, or family member. In a study over eating-related anxiety disorders, it showed that there was 90% improvement when children partaked in individual therapy. There was also a meta-analysis done by N. Albon, which showed that most types of therapy, including both individual and familial, saw a reduction in anxiety. This showed that individual therapy helped a lot with reducing anxiety, but it also showed that the familial therapy was really helpful for children whose parents also had anxiety. Both of these ways were proven to be very effective, but one was not proven to be better than the other. In this meta-analysis, there was a review by Compton which showed that cognitive behavioral therapy, which is a cycle-based therapy or talk-based therapy, was proven to be the therapy of choice for treating anxiety in adolescents. All the 24 studies in this meta-analysis showed that cognitive behavioral therapy was the most active treatment. It was 68.9% effective in recovery. The limitations that we found for therapy were cost and effectiveness. Therapy is not cheap. It can range anywhere from $50 to $300 per session. This can build up as some children need therapy multiple times a week. There are ways to reduce this price, such as some insurance plans will cover part of it, and there are also now some online resources which are lower in price than in person. But overall, these resources only help lower it by a small amount, and some parents in general just don't have money to put towards giving their children therapy in the first place. A study done by Finn showed that intellectual development is needed for cognitive behavioral therapy, and a lot of younger children aren't able to partake in some of the therapy practices. This happens especially in the cognitive behavioral therapy, and even though both have been proven to be effective, it's seen that some children are just too young and therapy isn't a one-size-fits-all. So it may work for one kid, but it might not for another.
So we believe therapy is the most effective solution because of the coping mechanisms and advice which can be given. Since these benefits are seen to be more long-lasting. And although medication may be the best option for some, the benefits from medication may begin to subside at some point, making therapy a more reliable solution. Now, because medication's benefits may eventually begin to stop working, in many patients it leads to overuse, which can lead to dependency. So, therefore, therapy is the most effective solution for treating anxiety in adolescents.
Okay, thank you. Give him a hand. Okay, Hannah, give one specific way that your thinking changed as a result of learning about Calista's findings.
Calista's findings dealt heavily in eating disorders in adolescents, and mine was mostly just about basic side effects and causes. And so she dived deeper into how certain relationships can cause a spike in anxiety in children, and that personally helped me really further develop an understanding of how relationships can really affect anxiety in adolescents.
Okay. Caroline, how did the group decide to include Nola's perspective, lens, or conclusion into the overall presentation?
So Nola's research was mainly based on parent relationships with their children and how divorce and parent loss can affect how the child's upbringing and their mental health. And so I feel like since our team presentation was revolved around children, her research was a huge part of our presentation.
Okay, Nola, describe an argument from one of your peers' individual reports that made you think differently about your team's solution or resolution.
So in Hannah's individual report, she looked a lot on just where anxiety starts and where it goes from there, and then also looking on the help from medication. That really helped us just bring a broader idea to what anxiety is, just starting where it goes from, and then from there we were able to kind of break off and go more deeper into specific areas, and so it just really brought up the attention of how major anxiety was.
Okay, good. And Calista, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem your group identified?
Well, with my research, I found that the surrounding people or environment greatly affected teens and how they view themselves, which resulted in eating disorders such as anorexia nervosa. With Hannah's findings on how with Nola's findings with how parents can also have an extremely significant effect on their children, resulting in anxiety disorders with them having divorce or not being there, significantly made me realize that the parent relationship between parents and children is very delicate.